Hi, I'm Learmonth and I'm a PhD candidate at Swinburne University of Technology. My research looks at the data practices of healthcare organisations and how they collect and use data about relationship type. Specifically, I look at multi-partner relationships and how healthcare organisations can account for multiple and concurrent relationships to inform sexual health services. There's certain recent research which recognises that accounting for multi-partner relationships is really important, especially within the sexual health field. But in the broader context of sexual health, relationships beyond casual and strictly monogamous relationships aren't accounted for. And with recent developments in the requirements for organisations to have improved data capabilities, it's really important that this is something that's considered to ensure that everyone gets the healthcare services that they require. I think we have more access to our personal data than ever before, but if we don't really understand how these systems work, or even worse, if we don't feel that we're represented within these systems, then how can they really have a place in our society and support positive progression if there's a whole group of people that aren't covered by these systems? Through my research, I consult both with people who have multiple and concurrent partners as the people that are impacted by the systems, but also with key stakeholders from sexual health organisations and policymakers who are the users and developers of these data practices to explore the language used around relationships and their understandings. So my hope for the outcome of my research is the development of a framework for the inclusion of relationship type within healthcare data practices in consultation with both the consumer and the provider. I'm fortunate enough that both of my supervisors are senior researchers with ADM+S, and with the support of the centre they've been able to run workshops and seminars which I have been able to get involved with that both align with my research and that cover lateral research fields which contribute to my overall PhD.